Guys, welcome back to Medical Coding with Blue. Today's episode is all about where new medical coders should apply for jobs and what jobs should they apply for. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So I got a really long email today from a viewer with a lot of questions. And they even said how they watch my channel a lot, but a lot of these questions have already been answered throughout all of my 1,400 shows. But I'm going to just redo it again today, and we're going to go ahead and talk about this. But this is the thing that I will say. If you're brand new out there and you're looking for your first job in medical coding, yes, you are going to run into everybody wants experience. But how are you supposed to get experience if no one will hire you? Here's the thing I have always encouraged. I have always encouraged you all to arm yourself with a really good resume. And your resume is going to have all the things that it needs on one page. And then you're going to have a cover letter. I don't care what anybody says when it comes to, I heard you don't need a cover letter. I'm a professional resume writer. If I am a hiring manager, I expect to see a cover letter. And not a cover letter that's a regurgitation of your resume, because I can see your resume. You don't have to repeat what's on your resume on your cover letter, because that's not the purpose of a cover letter. The cover letter is that human draw. It is the, hey, it's nice to meet you. This is what I'm here for. The resume is all the data. It doesn't have any of the personality to it. It's just got the facts, right? But that cover letter is going to be that draw. That's going to be the thing that's going to get people to say, okay, you know what, we're going to go ahead and look at this person. Yes, there's a lot of stupid AI software out there that will automatically reject resumes, and they do it for a bunch of different reasons. But I will say that, again, AI is dumb because it is looking for specific words. And if you don't have specific words, like the words that are in the job listing on your resume, right, then it's going to automatically think that you don't have the skill, because remember, it can't read. It is just looking for data, right? So these ATS readers, they're doing their thing, right? Because that's what they're programmed to do. But what I've also suggested time and time again is that there's no guarantee that this little trick will work, but it is going to set you apart from other candidates. I encourage people to go ahead and apply online for jobs, absolutely. But if you get an automatic rejection, you really want to work at that place, you physically print out a copy of your cover letter and a copy of your resume, and you mail it into that facility. Because 9 times out of 10, they're going to have the contact information for that particular job listing in the job listing. So when it's mailed, it has to physically go to somebody. Somebody is going to get this, and somebody is going to look at it. And if I am a hiring manager and I see that somebody thought outside the box and sent me their resume, because we're not going to allow AI and the stupid ATS reader to stop us from getting a job and from sharing our skills. Well, I'm going to say, you know what? This person's got some moxie. I want to interview them and see what they have to offer. And even if you don't get that job, even if they just want to meet you, it's practice. Every single interview that you go on is going to be practice, okay? But I want to read this message before I get too far into it. But the thing about it is, guys, I'm happy that you all want to send me messages, but please, really long emails, I mean, come on. Break it up or do something, because long emails take a lot of time. I'm just saying. But here's the message. The viewer says, how do I know where to apply? I'm guessing it depends on what I'm looking for or qualified for, but my fear. And what did I tell y'all about fear? Fear is a useless emotion that gets in your way and robs you of dreams. Okay? That's my belief anyway. Fear will rob you of your beliefs, in yourself, what you can do, and all of that stuff, because you're afraid. Afraid of what? And so they go on to say, my fear is to land a job at a hospital and hate it. I mean, immediately, we're just going to hate it. That's their fear. This is an irrational fear, because how do you know? And then they said versus landing a job for a private practice and loving it. See, already this person has it in their head, two different scenarios, working for a hospital versus working for a doctor's office. And I'll get into this in a second. What is inpatient coding versus outpatient coding like? Is inpatient coding more demanding / high paced? Is private practice for more experienced coders? Okay, this person has it completely backwards. When you're working for a hospital, as I've said, if you work inpatient, the sequencing has to be correct. The DRG classification has to be correct on a patient that's staying in a hospital, because there's a huge difference in payments. Depending on the DRG class that this person is in, that hospital could receive a $10,000 payment or a $100,000 payment. So if you are doing it wrong, that hospital could get a fraction of what they would have appropriately gotten if the coder was competent. But we're going to put that aside for a second, okay? And I may have to talk about that in another video, because again, I've talked about this, but we're going to go over this again today. The thing that I will say is this: your preconceived notions of, well, if I get a job at a hospital, I might hate it, but I might really love working for a private doctor's office. Here's the problem with working for a private doctor's office. Now, private doctor's offices often have very limited staff. They have a very limited budget, okay? Because this doctor is just trying to be on their own. They don't want to work with other people, other doctors maybe, or maybe it's just a small practice, and they say, okay, we don't want to really deal with all the big riffraff of a hospital, so we want to be, on our own. Well, that means you're going to have a smaller budget to work with, okay? And this means that it's usually the spouse or a really close friend of the provider that is going to be the person in charge, right? The head biller or whatever, right? So they're going to expect you, if you stroll up in there and you're just so excited and you're like, oh, I'm a medical coder. Now you have the certification, right? And you have somebody who is 9 times, well, I would say 10 times out of 10, because I have yet to see anybody that's in that position that's a spouse that's actually certified as a medical coder. I'm not saying that they're not out there, but I'm just saying it's very rare. Because even I tell my providers, when you all leave me and you go out in the big bad world and you go make your own practice and stuff, and I said, and you have your spouse to do the billing and to head over the coding part of the house, you better make sure that she takes a coding class. Blue, why are you going to say it like that? Well, because this is a serious thing. There was an optometrist or ophthalmologist, one of the two. His spouse was the one who did the billing. Well, she ended up billing fraudulently, or they found out on an investigation. She ended up getting 3 years in the federal penitentiary, and he got a $300,000 fine. He's still practicing today, but she's locked up. All because she either she knew, she thought she knew, or she's got it all, she knows everything, and didn't do a billing class, or whatever the case may be. But I guarantee you, she probably didn't do a billing class. Okay, and I'm just assuming. Okay, I could be wrong, but it's unlikely. Okay, because a lot of times spouses in these positions, they say, well, we've always done it this way. This is the way that we've always billed it, so we're just going to continue to bill it this way. This happens. And people that stroll up in there with their certification and everything, all of their education, well, this person now becomes a threat. Okay, so I don't want this person to try to outdo me. So that's just one of the scenarios that happens, guys. They get into a very complacent mindset in a lot of these private practices, and they want to do things their way. Not all the time, but a lot of the times. Okay, so there's that. Not only that, if you're working for a small practice, you're going to be wearing multiple hats. It is not unusual for somebody who is applying for a medical coder position to say, okay, well, we're going to have you do other duties as assigned. So if the secretary doesn't come in, you're going to be checking patients in. Oh, if we need somebody to room the patients, you're going to have to go room the patients. Oh yeah, and by the way, you're going to have to clean up the room once the patient is done. Even though you got hired on as a coder. Why? Again, because we're working with a smaller budget. They're not going to pay you. You may not pay you as much as you could be making, right? Not pay you as much as you could be making. And again, the chances for advancement are going to be very small, because why? You're in this single office. You're in a single office, and unless you know the person, now again, I could be completely wrong, but a lot of times you will find that I am correct when it comes to this, unfortunately. Do I wish more spouses of providers would get in a medical coding program so that they can learn the proper way instead of, oh, we've always done it this way, or the insurance always pays it out like this? It doesn't necessarily mean it's right. I'm just saying. So again, if you're working for a small doctor's office, not only that, now you're going to have a smaller department to work with. And this is going to mean that everybody's going to be working in closer proximity. There's no space. There's no space as far as like, you're going to see these people. You're all in one little complex. You're going to see these people all the time. You do see these people all the time when you're working for a hospital. But again, if you're working in a separate area, that's going to be something different. Okay. Now, working for a hospital, on the other hand, now we've got a little bit of movement. Because guess what happens when you work in a hospital? Number one, it's bigger. Okay. Number two, there's more of a room with a budget. Okay. There's a little bit more wiggle room with the budget because, again, now you've got corporate funding, you've got state funding, you've got all these other fundings going on. So there's a little bit more room to pay the people more. I mean, again, I'm just saying, these are things for y'all to think about. If you're working for a hospital, there's more of an opportunity that they're gonna have the incentive of wanting, to pay for you to go to school. They do have funds in like these big hospitals, big corporate hospitals. They have funds for education. You see it all the time. Even at my facility, they have tuition reimbursement. Okay, so there's a lot of that tuition reimbursement money for those types of things. They'll pay for books, they'll pay for all these things. Whereas a private doctor's office, they're not going to see that need because, hey, we always do it this way, right? And you're just a low man on the totem pole. So do you think you're going to have I can do all of this and, we can do this, we can do that. You're going to be fighting an uphill battle working for a private doctor's office. But again, if you're over here at the hospital, you get in as a medical coder, right? And then you say, you know what, in a couple years, 2 years, 3 years, you say, okay, well, I think I want to start developing as a physician educator. And you start doing that. Okay, now I want to do CDI, clinical documentation integrity. Okay, cool. And so you start to build from that. And now you're starting to build a little bit more on your resume. There's a few more things that you could do. Lead medical coder. That's also another one once you've had experience. And you're going to be working with other coders. Then the diversification of all of the things that you're going to be able to code for versus working for a single hospital, a single doctor's office who is coding for one specialty and coding the same thing all the time. And for some of you, that may be the ideal situation. You don't want to have to think about all of this stuff. You don't want to have to do so much more studies. But you're vastly limiting your earning potential. You're vastly limiting how far you can go in your career. Because again, if you're doing the same thing over and over again, you're not expanding your horizons and getting more experience. The person who works either in the hospital outpatient clinic in a hospital, or even for the professional fee side, they're going to get a lot more exposure to different things. There's the emergency department, there's orthopedics, podiatry, rheumatology, neurology, pulmonology, cardiology. There's all of these clinics that are in a hospital, and that's all outpatient coding. Okay, so you can't say, I can't work at a hospital because I'm not certified. I'm only certified in outpatient. They have outpatient clinics in a hospital. And so that's what you can apply at and get that coding position and then be able to move around. Or if you wanted to say, okay, well, I'm going to start off on the revenue cycle in a hospital and work my way over into coding. So you start off as a biller, working in third party and that kind of thing. You're working as a biller and things like that. And if you tell me, well, I don't want to work as a biller, then don't, love, don't. You start wherever it is that you want to start. I have said several times, even if they're asking for experience, you're still supposed to apply. Because as soon as you get your certification, this says you have competence. Now, yes, you don't have the time in yet, but that doesn't mean that you can't apply. If happy coders are in the area, they will stay where they are. They are not going to move. They are not going to, try to uproot themselves. If they're really happy where they are, they're going to stay. So this leaves a hole in the market, because now these employers are saying, hey, we want 3 to 5 years experience. Well, if you get desperate and you have no coders, now you're going to have to start looking at these new coders. And my new coders, you need to be coming in there full force with knowledge. Not, oh, I need training, because no one wants to train. So let's go ahead and take that off the table. If you were able to get through the school, right? You were able to study, maybe you went through my independent study, maybe you studied all the way up until your certification, you got your certification, you're feeling pretty good about yourself, but you're running into that wall out there trying to apply for medical coder positions, and they're just not hiring you because your resume is messed up and you have not looked at my videos yet about resume tips for medical coders. Oh, Blue, you have so many videos, I don't want to go back through. Guess what? I'm on Google. You can Google me, Medical Coding with Blue resume tips. You'll see all my videos for YouTube pop right up, and it'll take you right to that video. So you have that opportunity to do that. You don't have the excuse of, oh no, I'm a bad resume writer. If you listen to me in the video when I explain all the things that you need to be saying on this resume so that you can make yourself look good. And instead of thinking that, oh, well, no, I want to add all this time back from the early 2000s when I worked as a ward clerk and, I got all this experience. Well, guess what? You only need to go back 10 or 15 years, and that's it. Because again, the resume is just a quick snapshot of your skill set and what have you been doing over the last 10 or 15 years, right? Any further back than that, you're dating yourself, and we don't want that. It's not dishonest. It is, what is your relevant experience? Do you think any of your skills that you knew from greater than 15 years ago, do you think any of those things apply today? Absolutely not. Even if you worked as a ward clerk in the early 2000s or in the late 90s, nothing is the same. Nothing is the same. The laws are not even the same, okay? High tech came out in the early 2000s. So again, the electronic health record, you know what I mean? Like that was fairly new in the early 2000s. So those are things that you need to think about. When I'm telling you this is what you have to do, don't question it. Just follow it. And trust me, you're going to see things start to turn around, because I've been in the industry. This is my 17th year, okay? 17th year in this industry. Doing the things that I love to do. And then being here with all of you and trying to help you all. But some of you just resist me so badly. I don't understand it. I mean, to me, that none of this was here. When I was in school in 2007, there was none of this. Or that at least that I thought of on YouTube to go and look. Nothing. And so now it's just like, okay, this is all the things that I wish somebody would have told me. So the positions that you want to apply for, if you can't get in as a medical coder, right, is the alternative jobs, which I've done a whole video on that several times. Medical biller, okay? Some people want to fuss about that. You don't want to do that? It's fine, guys. Don't do it then, okay? Go for prior authorizations. Prior authorizations gives you exposure to the electronic health record, which you can add that to your resume, right? So if it's Epic or Cerner or eClinicalWorks or whatever, you can add that. And then it's giving you exposure to being able to look at documentation and abstract what's going on here, diagnosis and procedures. And so that way you can kind of know and understand, right? So that's going to be real helpful. Working for the insurance company as a claims reviewer, not to approve, because there's nurses that can do that, right? But this is the claims processor, somebody that is working for Blue Cross Blue Shield or Aetna or any of these places. And what they do is they receive the claims from the doctor's office and they run them through an encoder. Now the encoder is going to pop up with all kinds of edits. If there's an edit, then you can deny that claim, right? There's a good chance that something's wrong with it. And you can say, okay, this is denied. Okay. And then you go about the process that way. And a lot of times the people that get hired for those, high school diploma or GED. And here you come in, strolling in with your medical coding certification. So this means you have an understanding of medical coding guidelines. You already know what's supposed to be going on here. And even though this is your first time out of the gate, it's going to take you to be exposed to the records so that you can start to get comfortable and familiar with what's going on. The beauty part of working as a claims processor is that when the codes are already done, coding is already done, and you're using an encoder to help you. An encoder is an electronic code book that's going to pop up with, this is an error or something's wrong here or whatever the case may be. And you're going to be able to, okay, I can connect the dots. Okay, this is either approved or it's denied. And then you give your reasoning for that. But that's a place where you can get experience. And if you come over from, well, I used to work at Blue Cross Blue Shield and I did the claims processing. Do you know how that's going to be like catnip to some of these hiring managers? To be like, okay, then that means that they understand Blue Cross Blue Shield. Excuse me. And we take Blue Cross Blue Shield. So who better than somebody who used to work for Blue Cross Blue Shield? So that's something that's another option, okay? Now, you can also do charge entry. Now, charge entry is not going to get you coding experience. It will not get you coding experience. But what it will get you is exposure to the codes and exposure to the records, exposure to the electronic health record. There's all of those things that can be transferred over to a position, okay? So that's the thing that you want to consider. There's also risk adjustment coding. Now, risk adjustment coding, I will say, and I will always say this is a short stay job. Do not stay in that job for longer than 6 months. And before any of you gets upset and get your feelings hurt, I'm telling you this right now. The thing about risk adjustment coding is it's for data collection, right? It's just for data collection. And what they're doing is they're looking at these records. And Medicare was the one who started it. And they're saying, look, we need to be able to plan for these Medicare funds into perpetuity. We need to plan on how much it's going to cost people who have these conditions. And if they have this condition, we need to know if they have a potential for this condition or this condition or this condition, because it can help us to plan for like early prevention programs or education programs on how people can better take care of themselves and that kind of thing. So there's a lot of data and a lot of really good information and strategy that can come out of risk adjustment coding, okay? But you need to be really strong with pathophysiology because it requires you to know symptoms versus a definitive diagnosis, okay? The only problem with this is it is just diagnosis coding. There is no application of evaluation and management codes. There's no procedure coding. There's no modifier application. There's no HCPCS coding. There's none of that. So it's going to vastly limit your transferable skill. Again, this is why I say to spend only 3 to 6 months there. Because if you end up staying there for 4 years, because like a lot of people write me and say, Blue, I've been in risk adjustment for 4 years and I just could never get myself out of it. No, you could. You just never tried, or you never had the confidence to say that, yes, while I learned risk adjustment coding, I can certainly learn a coding position, a full-fledged coding position that is going to make me use evaluation and management or CPT procedure coding or any of those things, HCPCS. So it is possible for you to move on from that position. A lot of people just get scared and don't want to do it. But this is not the time for you to be scared and not move, okay? Move as far as like move on to another position, okay? And so that's something that you have to think about when you're getting into this field. This field is not about being shy. This field is not about excessive worry. This is excessive worry for nothing. Excessive worry for nothing. Fearing working in a hospital and hating it. Why would you hate working in a hospital? Like, I don't understand. Because I've only worked in hospitals. I've only worked in hospitals, okay? And yes, I still know about private doctor's offices too. But I'm just saying, I've only worked in hospitals, and I've loved where I've worked, right? I've loved where I've worked because I love what I do. Do I let it bother me like all these other things? A few years ago, before we moved into this big, beautiful new hospital, I was housed in a miserable little tin can of a room with 20 women. That wasn't the easiest time. You work around that many women, oh, trust me, there's drama. But after a while, when you're in the field and you start to mature and you start to think, why am I here? Because I would get so irritated, like with some of the situations with the girls, and there was so much drama and things like that. And I'm like, and they tried to drag everybody into it. Oh no, no. Blue does not do drama. Okay, Blue does not do drama, and I refuse to take part. So I started to ask myself, why am I here? I am here for my providers. That's why I'm here. And after that, it was like a weight lifted. I didn't have to worry about any of the drama, nothing going on with the girls. I didn't have to care anymore. The only ones that I had to care about were my providers and, by extension, the patients that they were seeing that I was coding for. That's all I had to care about. And that's still what I look at today, is my providers. I don't really communicate a lot with a lot of the girls, only very few of the girls, because I tried to keep my exposure to all these other nonsensical things very small. That's why I only limit to certain girls, and that's it. And the rest of my energy goes to my providers, and that's it. So again, if you're thinking about, oh, well, all of these things, you're imagining all of these situations in your head that haven't even happened yet, you're already setting yourself up for failure. Stop it. Just stop. Because you're always going to be at the mercy of somebody else if you think like that. And it's going to limit you. Do you want to be limited? Because I'm going to give you the blunt and honest truth. I will give you the blunt, honest truth. And that's what I do. That you're going to get out there, you're going to apply whether they're asking for experience or not. You're not going to sit here and be distracted and wonder if you're going to hate this job or not hate this job. Are you ever going to apply anywhere? Think about that. Okay? That's just what I'm saying anyway. But with that said, just apply and keep applying. And even if they're asking for experience, if you get rejected, mail in your resume. The worst that could happen is you don't get an answer. But what's the best thing that could happen is that you do get a response. Hey, you know what? This person had the guts to send us their resume. Let's go ahead and call them in for an interview. Let's meet this person. So they call you in for an interview. And that's how you get your foot in the door. That's how you start networking and making connections. Because this person was so thought outside of the box to send us a resume. And it's got to get to that person. They can't ignore you. Your resume cannot be bypassed because of a stupid AI ATS reader. It has to physically go to somebody. They have to see it and look at it. Make it worth their while to look at. One page resume, one page cover letter. The cover letter does not repeat what's on that resume. It does not do that. Your resume has all pertinent, relevant skills. Not organized, team player, smiling face. If I see those, that's an automatic. I don't want this one. Automatically. Because you're not telling me what I need. You're telling me what you think I want to hear. And that's not the way that it is. You tell me what your skills are. And your skills are what you were trained on in the school. Or even if you did self-study. ICD-10 CM, CPT, HCPCS, ICD-10 PCS if you had that. Medical terminology, anatomy, pathophysiology. All of those things. That's what you do. Okay? Look through my videos, guys. All of it's there. Okay? If you need tutoring, I do tutoring. My rating contact is in the description box below. If you want your resume done, rating contact is in the description box below. But be advised, my next availability will be in April 2025. Just saying. So with that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share. And I'll see y'all next time. Bye.